Welcome to Let's Talk About CRPS, a podcast brought to you by MTI directly from Italy. We will talk about the latest news and treatments, patients' experiences, and exclusive interviews of CRPS experts. Don't forget to subscribe to our YouTube channel and visit our website crps-treatment.com. Let's take off!
Welcome everyone, Marco Ferraro is here speaking, ready to introduce my guest of today, Sandra Brankovic, to talk about again to the CRPS problem. Okay, we are inside the context, inside the area of medical tourism Italy, but I want my guest to talk first. So, welcome here Sandra, ciao, ben arrivata.
Ciao.
Okay, so I would like you to give me a little description of yourself. What can you tell?
Well, I'm Sandra,
okay.
as I just said. I'm Patient Care Coordinator of Medical Tourism Italy, so I usually handle all the communications with patients, and I basically work mainly with that, so we are from the CRPS department.
Okay, a little brief now about the CRPS. What is this?
It's a chronic pain condition, and it's very, very painful. As you might have heard, it stems from an injury, and it's usually described as painful as giving birth sometimes. So what we do here is we want to treat that, okay? We want to help people, and we do that through the treatment that we usually call Neridronate treatment, yes.
Okay. In the last episode of us, I have the pleasure to talk with Emily about the Neridronate, I think. Neridronate, sorry.
Neridronate,
okay,
yes.
okay. Well, what is this?
So it's medication. It has been patented as the treatment for CRPS here in Italy. So it's the main one that we usually, consider for this kind of chronic condition, yes.
Okay.
It acts on the root cause of the issue, so it's very, very important, and it deals with the actual root cause of it. And it's the center of what we call our 360 treatment plan.
Okay. Can we focus about the 360?
Of course.
Treatment plan, sorry, okay. Sure.
Of course, it's a treatment plan that we have created around the patient, okay? So usually patients not only need these infusions, we have seen that after many, many years of working with this kind of chronic condition, we have seen that they actually require a bit more of a 360 around it. So with different specialists in this case, they're very, very knowledgeable about this disease.
How did you build such a plan?
It takes a long time. Yeah, it took a bit, a bit of time with that. We're lucky enough to actually work with specialists who know everything about it. We work also with clinics, so we were able to create a big team, I would call it, a very, very good team of different specialists that work on the patient. What's important in this is that, as you might know, a lot of our patients come from America, for example, and what they do is they go from one doctor to the other, okay? They do not seem to find the right specialist for this kind of disease. So that's what we do for them. We want to give them the best, okay? So we basically looked for all the specialists that could come together and give them a specific treatment plan tailored to their case, because every case is different, okay? So you need to first analyze it and then come up with the right path for them.
Okay. What were the first one or two questions you faced before planning the treatment?
So we wanted to give patients what they were not used to. Okay, so they were not used to being listened, they were not used to having someone actually understanding what they were going through. What we wanted is to find the right person for this, someone who's empathic, someone who knows a lot about it, and someone who actually works hard on giving them what they need.
Okay.
Yeah.
What are the specialists involved in this treatment plan, Sandra?
So the main specialists in this case, aside from us, which are the ones who work on giving them this kind of access to the treatment, will be the rheumatologists, for example, since CRPS is a rheumatological illness here, and that's the doctor who usually supervises everything regarding the treatment, so from the infusions to everything else. The other specialists would be the physical therapist, who's also the osteopath, who works along with the health coach, for example. So they work in tandem together to work more on the physical side of it, regaining motion, regaining the muscle that they usually lose, due to this condition. And also the nutritionist, since, it's an inflammatory disease as well. Okay. So patients have to have a good and proper diet that allows them not to have these flare-ups, who help them, cope with these conditions. So she creates a very good plan for them to follow. Yes.
For sure. What are the other therapies involved in this plan?
So of course, aside from what we do with the specialists, we also have been working and actually trying on ourselves as well, these complementary therapies that we call them. So they are usually provided at the hotel. So when patients come here, they already have everything ready for them at the hotel. So it's 2 therapies for now. One of them is the light therapy and the other one is the biophysical therapy. So it's 2 different machines that they get to use while they're here. For the light therapy, for example, it's a machine that recreates sunlight but without any UV rays. So it's completely safe to use.
Sure.
It helps a lot with the swelling, with the discoloration that they experience a lot. And it actually helps the regeneration of cells in the affected area. So patients are supposed to see some changes even, after some usage of it for some hours. While the biophysical one, it's a machine that works through waves, and sometimes the program is done during the night, so patients actually get to sleep through the entire thing. It's supposed to stimulate your immune system, and help your body basically fight off the CRPS in those affected areas. So it's something that we have been trying and, error and trial and everything else, but we finally came up with the right machines for this, and it seems to be, doing very, very good.
Okay, how does the treatments take every single sessions? I mean, about the time.
So for the light therapy, for example, you have to use it at least half an hour a day. If
Wow.
it's more, it's even better. Okay. So whenever they are at the hotel resting, they're supposed to use it.
You know best for sure.
Yes. While for the biophysical therapy, it usually lasts almost 6 hours during the night. Okay. So depending, it has different plans for each patient. So it can last a bit less in some cases, but usually it's those 6 hours during the night. That's why they usually sleep through that, because we don't want them to just lay down for 6 hours.
Oh, sure. How to get started?
So the first step will be to contact us. And the next step for us, after of course talking about the treatment, discussing everything,
Look
would
at
be,
details down here, okay? Just,
yes,
okay.
would be the evaluation with our doctors, which is completely free. We require just a very short list of documentation for that. What we do is we send that to the doctors, discuss that with them. In a couple of days, we actually get the answer. Of course, patients will know if they will be a good candidate for it, what they can expect from it, and which is important before making the trip here. And once we have all the confirmations possible on the medical side, we try to talk about the trip, when they would like to come, when we want to book the treatment. So that would be the very first important step. Yes.
Okay, so now you got the phone, you got the camera, and you got the time to tell to all the CRPS patients there something that they need to know before starting.
Well, it's important to know that we are here and that there is hope and there is possibility to get better.
Okay.
Just putting it out there.
It's okay, it's simple, but it's effective. Okay, thank you for your presence here.
Thank you so much as well.
See you next time, okay?
Yes,
Ciao,
definitely.
Sandra. Bye-bye next
Bye-bye.
time. Ciao, ciao.